Chapter 15, Physical and Cognitive Development in Middle Adulthood. Okay, basically, we're talking about the ages of 40 to 65. And what this slide is trying to say is that middle adulthood represents a continuation of changes in early adulthood, physical and cognitive. Remember, we said that senescence begins in early adulthood, but is not noticeable right away and is very gradual. Here in middle adulthood, some people are going to begin to feel some of those changes, not others. The more modern view, contemporary meaning more modern view, current, is that middle adulthood is not really old age, but rather a midpoint, a point where we're neither very young nor are we old, and we're looking back on our life, trying to make changes to get it on a good path, or continuing a path we're satisfied with. All right, the first set of slides goes through the senescent changes that you begin to notice in middle adulthood. Remember, these changes started in the 20s, often around the age of 25, but in middle adulthood, these changes are more advanced, and again, we're going to notice some. Changes in vision and eyesight are ones that most people tend to notice first and do become noticeable in middle adulthood. The very, very first one is related to presbyopia, which just means old eyes. It's the inability to adjust your focus to varying distances, which means you become more far-sighted or have an easier time seeing far, seeing distance, a harder time seeing up close, reading. Many middle-aged people need reading glasses, and that's the early sign of presbyopia. Presbyopia happens for two reasons. Number one, the muscles that adjust your focus in your eyes, the ones at the sides of the eyes, become weaker with age. And also, remember we said that all the soft tissues in your body become stiffer, less flexible, less stretchy. As a result, again, your eye is going to have a more difficult time effectively changing shape to adjust to the different distances. When the eye is completely unable to change distances, then the person fully has presbyopia, and that does not happen until later. But a mild problem with reading begins in the 40s or 50s. Most people notice it then. Some people notice it in the 30s, and you do need reading glasses. Now, in addition, there are changes in the vitreous humor, the liquidy part that fills, or the jelly part that fills up the inside of your eye. Your pupil shrinks, and the lens begins to get a little bit yellower. This is from, over time, lots of repairs. The thickening of the lens also changes the color. This is not something that's going to be noticeable in middle age. It's not really noticeable until old age unless you have a more advanced problem with your eyes. However, you also have some changes to the nerve cells at the back of the eye on the retina, which process light and color. And so again, these abilities decline a little bit. Most people don't notice them, but some middle-aged people may notice difficulty seeing in dim light. Glaucoma is an illness. It is not normal aging. However, the risk increases with age. People who are of African American or Hispanic background have a little bit higher risk of glaucoma. There also seems to be some link to diabetes. So if there's diabetes in your family, or if you have diabetes, definitely don't neglect your eyes. Get them tested. Glaucoma is easy to treat, but if you miss it, it can cause permanent damage to the eye and even blindness. It's an increased pressure in the eye, which can in turn damage those cells, those nerve cells at the back of the eye. Hearing changes in middle adulthood. This is something that's a combination of what we call primary aging, meaning aging that happens to everybody. Normal aging process, can't do much about it. But it also has a component of secondary aging, extra aging that comes from lifestyle, environment, or illness. And we can do something to slow down or eliminate secondary aging. So presbycusis, meaning old hearing, is something that is partly primary, happens to everybody, but the part that's secondary from exposure to too much noise, we can slow down and fix by avoiding too much noise, avoiding very loud music, especially with headphones right into your ears. The first time you notice presbycusis, which by the way comes because very, very fine nerve cells, which are like little hairs inside your ear, become weaker and damaged and flattened over time, and more so with noise. Initially, the first thing you'll notice is a decline in your ability to hear high frequencies, high-pitched sounds like women's and children's voices. Men tend to show these things earlier and have a more rapid decline in their hearing. It may be in part primary aging, but it's probably more likely to be, secondary. What's going on? My computer's freaking out, excuse me. Secondary aging, more likely to be because men might be exposed to more noise. What can you do about it? You can modify your listening environment, meaning have less extra noises so that you can focus on what you're listening to. You can use hearing aids and have people who look straight at you when they speak can help. Skin changes. Lighter colored skin, because it's more prone to sunburn and sun damage, gets damaged and shows its signs of aging earlier. Darker skin looks younger longer. What are the signs? Wrinkles and sagging. Why? Because our skin, like everything else soft in our body, gets less stretchy. Also sagging. The skin is a little less firmly attached, so you get those little kind of saggy spots along your neck and chin, on your arms and legs. Age spots, especially people obviously with lighter skin, it's more noticeable, but some spots darken on the skin. And that tends to happen after age 50, and it varies a lot by people. People who have more sun exposure and women rather than men are more prone to these skin changes. Muscle fat makeup. Okay, first of all, fat redistributes in old age, meaning if you put, in middle age, and continues into old age. If you tend to put weight on, in middle age, it's more likely to come in the middle. So that stomach, for men on the back, for women in the waist again in the middle, and the upper arms. So you could weigh the same, but you have a little bit of a different shape. There's also very, very gradual weakening of the muscles. Again, softer tissue becomes less flexible and strong and stretchy. So how do you slow this down? By strengthening your muscles and avoiding fat. So you have a good, healthy diet and you exercise, and therefore you avoid some of these problems. Calorie restriction, this is a weird thing. I'm not going to go into it in too much depth, but let me explain it since it is in your book and it is sort of something people are looking at. Some researchers have found that if people are extremely lean, meaning they have good nutrition, but they are as thin as they can possibly be, have a minimum of fat stores, this can lead to a longer life. We have not studied it in humans. We've only studied it in rats. They have longer life, less disease. In primates and humans, we find that people can stay healthier, but there's no proof that they necessarily live longer. It's hard to study in humans. Most people aren't willing to do it. It also doesn't just mean starving yourself or being extra skinny. It means that every bite you eat has to be full of nutrients so that you can eat the absolute minimum quantity and still get the quality. And this is a very difficult regimen to maintain, particularly if we're not certain of its benefits. All right, skeletal changes in the bones. Bones become more porous, meaning less full on the inside. Bones are filled with sort of a spongy material, and they become less dense, less tightly, thickly packed inside with age. Women who have lighter bones to begin with are at higher risk. White and East Asian women are at slightly higher risk of bone loss, and thinner people are at slightly higher risk of bone loss. Why? Because you don't strengthen the muscles as much, you don't put as much work into your legs holding yourself up. Okay. So what happens as your bones lose strength? Again, this is not something you're going to notice in middle age unless you have a severe problem. But eventually, especially in old age, the discs of your back begin to collapse, come closer to compress, can't hold you up as straight, and so you actually lose a little bit of height. Bones also break more easily and heal more slowly. Again, a healthy lifestyle, good diet, enough calcium and vitamins, and exercise can slow down bone loss. The climacteric. This is the point for both men and women when the body slows down in the manufacture of sex hormones, thereby decreasing fertility, and for women eventually ending it altogether. In women, we call this process menopause. The age range to begin menopause is late 30s to late 50s, but the average age of menopause of the end of menstruation is 50. It happens a little earlier for women who never had children. It happens a little earlier for women who smoke. What is the climacteric? What is menopause? It's a drop in estrogen. The monthly cycles at first shorten, meaning at first you get periods closer together, and then they start slowing down. You get them further apart, and eventually they stop. It is recommended that you don't assume that you finish menopause until you haven't had a cycle for a year, because sometimes they can be very widely spaced before they stop. What are the symptoms of menopause? The loss of estrogen does a few things. It decreases skin elasticity even more. That's why we said women are more prone to the wrinkling than men. Loss of bone mass. Estrogen protects the bones, and so when you have less of it, that loss of bone mass increases, which is why women are more prone to it. The complaints about sexual functioning are mostly related to this decreased skin elasticity and also vaginal dryness, less lubrication with the loss of estrogen. That is something that you could do something about with simple intervention. What's going on? It's losing its mind. Okay. What are the symptoms of menopause? Hot flashes and night sweats. Again, not everybody has these. Every person's different, but many women do. Japanese women do not have any hot flashes, and we're not certain why. This is a physical response. It wouldn't seem to be psychosomatic or simply cultural, but it could have something to do with the soy that women eat in East Asian diet, although adding soy to Western women does not necessarily get rid of the hot flashes. The sexual difficulties we just talked about. Things that are not linked to menopause directly, although some women do report mild symptoms, irritability, trouble sleeping, depression. These are things you should talk to a doctor about and try to treat. Don't assume, it's menopause, and brush it off. Okay, hormone therapy, hormone replacement. In the past, up until fairly recently, doctors figured, estrogen has benefits. It's good for the skin, it's good for the bones, it's good for the heart. It avoids hot flashes, so why not just give it to everybody who goes into menopause? And you see the benefits. However, it turns out that if you give it in menopause, you also increase the risk of some other problems. Most important, the worst ones, cancer and stroke. So there are alternatives. Women who have symptoms of menopause that really bother them can take medication to prevent bone loss. They can take some natural substances, something called black cohosh, for hot flashes. Antidepressants also can ease hot flashes in a modest dose. There are, in addition to physical reactions to menopause, emotional reactions. Big individual differences. How important was it to you to look young, feel young? How important was childbearing to your personal identity? Baby boomers, people who are aging now, are much more accepting of menopause than in the past, probably because of a shift in focus for women. There are big cultural differences. In Western nations, where we tend to medicalize everything, well, better go to the doctor and get a pill, people tend to feel the symptoms more because they're thinking, well, gosh, what can I do? I shouldn't feel symptoms. Let me go get something for that. There are ethnic differences depending on attitudes towards women, attitudes towards fertility, physical and psychological health. Obviously, the healthier you are, the better you react. And the more educated, the better you react. Now, we said this is all about menopause for women, but I said there's also a climacteric for men, where testosterone declines gradually. There's a decrease in sperm volume, meaning the amount of sperm in the ejaculate. The motility, how well they swim, slows down. And after age 40, there is a slight decrease also in the amount of semen that men produce. This is caused by a gradual decline in testosterone. More sexual activity will lead to more testosterone. People who have less sexual activity will make less testosterone. The body adjusts to what you are doing. Erection difficulties, what the TV commercials like to call ED, erectile dysfunction. What are the causes of that? It isn't something that has to happen with the climacteric. There are changes with less testosterone. The sexual response will be slower and less intense, but it will happen. And so if it's not happening, something may be wrong. It can be anxiety, it can be relationship problems, or it can be disease or injury or medication that the person is taking. Blood pressure medications, diabetes medications, particularly, and prostate gland problems can cause erectile dysfunction. And it's good to ask a doctor for help, not to be too embarrassed. And obviously we have drugs like Viagra, which are advertised nonstop, which can treat the problem. All right, health in middle age. Most people say they have great health in middle age. It's not as great as it was in early adulthood, but depending on your lifestyle, it can be excellent. People who begin to experience really bad health Okay, sorry about that. I turned the noise off on my phone. Do as I say, not as I do, and always turn your phones off in a lecture. Anyhow, I apologize. There's no way for me to erase that and go back, so I'm going to keep going. There are more chronic diseases in middle adulthood than in early adulthood, meaning people are more prone to diseases that are long-term and don't go away, like heart disease, diabetes, and some cancers. In part, this is because our immune systems are weaker and there are more autoimmune responses, meaning the body might react against itself. And that's associated more with some rarer diseases like rheumatoid arthritis, lupus, multiple sclerosis. But the diseases I was talking about, heart disease and diabetes, those are lifestyle related, combined with some of the primary aging, particularly the heart disease. Your blood vessels get stiffer. And so if you also have a poor lifestyle or a risk factor for heart disease, the two together can cause it to begin in middle adulthood. Okay, sexuality in middle adulthood. There is a slight drop in frequency of having sex among couples, but most people are pretty stable. Most people don't drop a lot. And the best predictor of how much sex you have is marital happiness, not age. So if people are getting along well, then things are going well in this area as well. As I mentioned a little bit earlier, because of the climacteric, because women have less estrogen, men have less testosterone, arousal is slower and less intense. The feeling may be less intense than it was when you were younger. But people adjust to this. It's a different way. It doesn't mean it stops, and sex is still important. It says that there's a gender difference in partner availability. This is pretty straightforward. There are more women on Earth than men. Men die younger. Women also are discouraged socially from marrying people younger or having partners who are younger, whereas men can have younger partners. And as a result, men have more partner choices than women. And in middle age and going forward into old age, women are less likely to have an available partner because there just aren't enough men to go around. And since more people are heterosexual looking for an opposite sex partner, that means women have fewer available partners than men. Okay, this slide I'm not going to ask you much about on the test, but just to show you that now in middle age, it's reversed. It's no longer injuries and other things, accidents that cause death, but rather cancer and heart disease because of that increase in chronic illness we talked about. Okay, I'm not going to go through cancer and cardiovascular disease because that's pretty straightforward. And, we're not going to focus on that for this class. I just briefly want to let you know that we talked about bone loss of bone density, but osteoporosis is a disease. It's an extreme bone loss, which is so severe that the bones become fragile. It's a combination of primary aging, normal aging, and secondary aging, heredity, body build, lifestyle. Women develop it earlier, but some men do get it. And again, how do you prevent it? Vitamin D and calcium. Weight-bearing exercise, meaning exercise that puts your weight on your legs, like she's doing here. Things to strengthen your bones. Strength training, meaning weightlifting to strengthen your bones. And early prevention. The earlier you start with a good diet and exercise, the better. All right, hostility and health. This is a place where the mind and the body really come together. And we talk about it in middle age because of heart disease risk. Hostility, type A behavior pattern is linked to your heart health, and so it's important to understand it. The type A behavior pattern is only prone to heart disease when there's the angry and hostile aspect to it. So a person who's competitive and impatient but not angry and hostile isn't going to have that increased risk of high blood pressure and stroke. However, a person who's rude, who has angry outbursts, who's constantly critical, who's always pissed off about something, that person is constantly putting a strain on their heart, and they're going to have cardiovascular problems. So these people, and literally everyone, should learn stress management. Reevaluate the situation. Is this worth getting upset about? Focus on things you can control, and if you can't control, you got to learn to let them go. View life as fluid, meaning things don't always work out as you plan, but you've got to be able to change. Consider your alternatives. Make sure your goals are reasonable. Don't be too hard on yourself. Get exercise, relaxation techniques, and good ones, not drinking, but rather breathing, meditation, mindfulness, etc. Try to reduce your anger and seek social support. Get help from other people. There are two basic styles of coping, ways of dealing with problems. The best is problem-centered. Identify and appraise the problem and try to solve it. That's kind of straightforward. Better to approach your problems head-on and try to fix them. However, you also need emotion-centered coping, ways to calm yourself down in the meantime. Especially if the situation can't be changed, you want to control your distress. However, you want to make sure those emotion-centered coping styles are positive ones. Denial, running away from your problems, getting angry at people, drinking, smoking, eating, shopping, these are not positive emotion-centered coping styles. Exercise, it's important. Beyond that, what do we say? Hardiness. This is a personality style that helps reduce stress. A hardy person is somebody who, first of all, feels control. They try to find things and experiences that they can control, that they can't change, and they don't give up quickly. They have commitment. They find interest and meaning in their daily activities, like we read in that New York Times article that you wrote about for homework. And challenge. They view changes and problems as a normal part of life and a chance for growth rather than a harm or an immediate threat. And hardy people experience less stress and are healthier. The double standard of aging. Okay. We let men get old, but we insult women who get old. We say men get distinguished, women get ugly. And obviously that's a double standard, and as it declines, things will be better for both men and women. All right. This slide, now we're moving into the cognitive or brain changes. This slide demonstrates a difference between cross-sectional and longitudinal studies and the kinds of results they give us in understanding mental changes over time. A cross-sectional study is a study that's done at one point in time. And so if you want to know how do things change with age, you have to look at, but you only want to do it at one point in time, you have to look at differences between age groups. So comparing, for example, people in their 20s, 30s, 40s, 50s, 60s at one point in time. And as you can see from the slide, when you do it that way, it looks as if abilities plunge. They get worse and worse starting in the 30s. Whereas if you look at it longitudinally, meaning following one set of people over time, it looks like they get much, much better in middle age and then level off, but don't get worse. It turns out that both of these ways of looking at mental changes have a little bit of a bias. The cross-sectional study has a bias that we attribute to what's called cohort effects. A cohort is a group of people who share a characteristic at a certain point in time. So, for example, people who are graduating from York College in 2014 are a cohort of students who would presumably be different in many ways from the 2010 cohort, for example. Different experiences, circumstances, environment, etc. Now, the cohort effect that seems to affect studies like this is changes in education. Our population has become more and more educated over time. We now require people to stay in school until they're 16. More people are graduating high school and more people are attending college. So the cohorts of young people today have more education, which makes them look smarter. It doesn't mean that the old people have lost abilities. It probably means they were not as educated to begin with, a cohort effect. In the longitudinal long-term studies, we have dropout effects. The very, very best and healthiest people are the ones who stay to the end, making people look better than they are. So as a result, there are two big studies going on in this country. One is by Warner Shea, the person whose slide this is. But both of these studies combine the best of both worlds, the cross-sectional and the longitudinal. So what they do is they follow people over time, but they started out with cross-sectional groups. People who were in their 20s, 30s, 40s, 50s, 60s. And every time there's a dropout, they replace that person with someone similar to themselves. So you can avoid that dropout effect. One is the Baltimore longitudinal study, one is the Seattle, and both are funded by the federal government because they're very big and expensive and hard to do. Okay. From studying intelligence and studying brain changes in old age, researchers have come up with the idea of two types of intelligence. We have both of them. We have both of them throughout our lives, but they're sort of different functions of the brain, and these two functions age differently. What we call fluid intelligence is basic information processing skills. It's about analyzing new information quickly. It rests in our working memory, the part of our memory that processes the information and gets it ready for storage. It's the part of our brain that helps us link things together, see relationships among different things, which helps us in turn store it for long term and remember it. Fluid intelligence declines with age because the working memory capacity declines with age. Our reactions slow down as we age, and working memory can only hold a limited amount of information at a time. If it slows down, then it may not process it fully when you're ready to move it to long-term storage and take in new information to working memory. Therefore, fluid intelligence declines. Crystallized intelligence are skills that depend on our accumulated knowledge, our experience, our judgment, and our understanding of our culture and our social world. Things that are valued by our cultures are going to be part of our crystallized intelligence. So it's our accumulated body of knowledge that does not decrease with age. We keep it. And if anything, by becoming more experienced, we can build it larger. Okay. So what predicts high mental ability? What people continue to function really well in middle and even old age? Lifestyle plays a part. Having education makes you have a stronger mental capacity. Having a complex or mentally challenging job or hobby. Having a good lasting relationship. Higher socioeconomic status, more resources and education again. A flexible personality keeps us more open-minded, helps us with those post-formal thought. Being healthy gets you more blood to the brain. The cohort of baby boomers are more educated. And having a little bit less loss in fluid intelligence, meaning higher perceptual speeds. Okay. Now, we said our brain slows down. Why does it slow down? Well, number one, neurons in the brain die, so you have fewer connections. Yes, we said the brain reroutes and forms new connections, but they're less efficient than the original direct connections. So eventually, as more of this happens, the brain processing slows down. It's less efficient. There's also a view that maybe because our crystallized intelligence is growing, we have more accumulated knowledge, you have to go through and inspect and interpret more information each time you're thinking. For example, every time you go back in your long-term memory to link a new idea with old ideas, if you've got more old ideas, it takes a little bit longer. And it's possible that both those are true. It's probable that both those facts are true. Okay, attention. Because of this slowdown in the brain, in middle adulthood, we have more trouble multitasking, focusing on the most important information, switching our attention between activities, putting visual information together into a meaningful pattern, and inhibition, ignoring things we are supposed to ignore. This is probably due to the decline in processing speed, but we can compensate with experience, practice, and mental training. Memory. Working memory declines, as we said, and we may use fewer memory strategies than we used to because that working memory is struggling a little more. We said our processing is slower and we don't pay as much attention. However, adults can compensate so that there's no change in mental functioning in middle adulthood, and we even can be better than we were when we were younger. If we train in mental strategies, we pace ourselves rather than doing tasks under time pressure. And of course, there are few changes in crystallized intelligence. Practical problem solving, everyday life. Evaluating real-world situations, analyzing how best to achieve your goals, and this is helped by expertise. The more experience, the more knowledge you have in an area, the better you get at it. And what is expertise? It's an extensive, highly organized knowledge base resulting from years of experience and providing efficient strategies for problem solving. Creativity. We talked about how expertise can lead to creativity, but creativity also has a fluid intelligence component, novelty. And so creativity in middle age is more thoughtful, it's less spontaneous, it's more focused on summing up or putting together your ideas rather than newer ideas. Job development and cognitive development. Okay. People tend to reach their highest level on their jobs in middle age. We tend to make middle-aged people managers. Why? Because they still have pretty good fluid intelligence, although it's slowing down, but they have much more expertise, experience, and practical problem-solving skills. And the more jobs are intellectually challenging, the more we maintain and improve our cognitive skills. Going back to school in midlife. More women go back to school than men, probably because women may have delayed school for child rearing. There are all sorts of reasons to go back to school: better income, change jobs, life transitions, or just because you always wanted to. Obviously, there's some concern about role overload, competing responsibilities, stereotypes. Oh, people will look at me funny because I'm a little bit older. Do I still remember what I learned before? But with support from friends, family, partner, children, and school and workplace, students in midlife do excellent work. And that's it for Chapter 15.